Mastoiditis. Mastoiditis is the inflammation of the mastoid bone, which is behind the ear. Etiology. Main cause of mastoiditis is acute otitis media. बात करें रिस्क फैक्टर की तो सबसे ज़्यादा चिल्ड्रंस में होता है ड्यू टू न्यूमोकोकस बैक्टीरिया. पैथोफिजियोलॉजी की बात करें तो ड्यू टू etiological फैक्टर it causes acute otitis media, and acute otitis media infection reaches to the mastoid bone ear cells. Then it impact on the mastoid bone or leads to the inflammation of the mastoiditis or inflammation of the mastoid bone. Types of mastoiditis: acute otitis, acute mastoiditis and chronic mastoiditis. Acute mastoiditis is the goes away within a month after treatment and not reversing. But chronic mastoiditis is the after treatment it reverses. After antibiotic treatment it reverses. Clinical manifestation: swelling, redness, fever, tenderness in the mastoid bone, purulence discharge, tinnitus. Tinnitus is the ringing of in the ear, irritability, lethargy. In severe mastoiditis, symptoms shows vertigo, vomiting, diarrhea, anorexia. Anorexia is the loss of appetite, and vertigo is the imbalance and dizziness combination. Diagnosis: blood test for knowing the infection, culture media for the knowing which microorganisms infect, imaging tests like CT scan, MRI, radiography for seeing the abnormality in the mastoid bone. मैनेजमेंट की बात करें तो मेडिकल मैनेजमेंट एंटीबायोटिक, मोस्ट एंटीबायोटिक ब्रॉड इफेक्ट ऑन एंटीबायोटिक यूज्ड पेंसिलिन. इफ एनी एलर्जी in the patient for penicillin, then we give clindamycin. With antibiotic we give steroids like corticosteroid, hydrocorticosteroid, neomycin, etc. And for relieving the pain we give analgesics like acetaminophen, ibuprofen. For reducing the temperature we give the antipyretics like paracetamol, crocin, dolo, etc. For relieving the vomiting case we give the antiemetics like domperidone. In surgical management we done the tympanoplasty and mastoidectomy. Tympanoplasty is the perforation in the tympanic membrane for the creating perforation in the tympanic membrane for purulence or create a hole for the leaking discharge. And mastoidectomy is the process in which we remove the infected area of the mastoid bone. We talk about prevention for mastoidectomy, how to prevent mastoidectomy. So first at all, pneumococcus vaccine is given for children for preventing them. follow up for the prevention, or follow up with a specialist, ENT specialist, prevent and control the otitis media, then limit the use of pacifiers, and don't smoke if don't smoke children, sorry, don't smoke if children having in your home, control allergy like measles or any communicable skin related allergy, prevents cold because it cause otitis media. With एनसीपी, बात करें हम एनसीपी का, तो एनसीपी में हेल्थ असेसमेंट या नर्सिंग असेसमेंट, तो टू असेस द intake and output of the patient, to assess the pain level of the patient, to assess the health condition of the patient, to assess the anxiety level of the patient, to assess the vomiters consistency and frequency of the patient, to assess the patient sleeping pattern, या sleeping pattern of the patient. ये कुछ कॉमन हेल्थ असेसमेंट है या नर्सिंग असेसमेंट है जो हम किसी भी डिसीज़ में लिख सकते हैं। बात करें हम एनसीपी का, तो इसमें 5 पॉइंट्स होते हैं, जैसे कि नर्सिंग डायग्नोसिस, नर्सिंग गोल या प्लानिंग, नर्सिंग इम्प्लीमेंटेशन और इंटरवेंशन, एंड फाइनली इवेल्युएशन।